Well, it's an important conversation to have, and most times when we just talk about it, it's as though something that happens every month, but it happens every month. And you know, one time here, I told you about the fact that every month comes with a newer experience that you don't know. So it's not something that you get used to. Your body changes, your biology tells you something different about your body every single month. But thank you so much again for joining us on the conversation. We just got off this talk with Mary Alu. She is the founder of Girls and Goals Initiative. But like we said from the start of the hour today, we'll be heading out for the second lap of the conversation right here on Rapid Dawn. Next up is mental health. We'll be back. All right, welcome to the second lap of Rapid Dawn right here on Rapid TV. And today on this second segment, we're talking about mental health, right? And it's Mental Health Awareness Month, and breaking the silence on depression and mental health in Nigeria is the focus for this this month's theme.
That's right.
And there is a silence in Nigeria that we do not talk about enough. Not the silence of peace, but the silence of people who are struggling, suffering, and carrying weights they have no language for and no safe place to put down. Let's have that. Now, we live in a country where insecurity has become almost normalized, where communities in the Northeast, the Northwest, and North Central have spent years under the shadow of conflict, displacement, abductions, and loss. Where even in our cities, the anxiety of daily survival, the economy, the fear, the uncertainty is taking a quiet but devastating toll on the minds of ordinary Nigerians. So mental health in Nigeria is a crisis hiding in plain sight. Joining us today on this conversation rather is someone deeply invested in closing that gap, the gap between the policies that have been spoken about and the implementations of these policies, to help us understand where Nigeria truly stands in its fight for mental health and what it will take to move from legislation on paper to genuine healing on the ground. We have today with us Deborah Omagi, and she is the program Associate Nigerian Mental Health. This is about the third time we're having you on our show. Thank you so much for joining us.
Thank you for having me.
Welcome once again, Debbie. Good morning.
Good morning.
Right. How have you been? Let's not talk the Nigerian answer, please, because you just gave the Nigerian answer. How have you been?
I've been well, definitely, but you know, it's been a lot here and there. Life be lifing.
Okay.
So we know, but yes, we're
Right.
moving.
All right. Now that we have asked how you are doing, let's talk about the fight regarding mental health here in Nigeria. How has that been so far? From the last time we spoke to you, there were some legislative processes that are being carried out. Is it now being implemented? Has Nigeria now fully recognized what it means for a person to be mentally not unstable now? And all of those.
Well, I would say that progress has been made, but it's been baby steps, and I think it's time we move beyond baby steps.
Okay.
That's the truth. Especially in relation to legislation. Last year, so many promises were made by the federal government, by other major stakeholders in relation to mental health. But beyond that, it was just all talk here on paper, you know, fragmented speeches here and there, but nothing has been done.
Okay.
And so right now, our focus has been, okay, it's time for us to gather all of these things. Yes, the government says this, and then by December they'll do this, they'll do that, but it's been 5 months, nothing has happened. It's been 8 months for some of them, and nothing has happened. So we're basically focused on ensuring that, you know, it's beyond just making all those statements and us cheering you on. It's time for us to hold you accountable to the public too.
Right. I think you just mentioned the federal government's announcement in 2025 talking about that they're going to decriminalize suicide here in the country, Nigeria. Of course, up until now, that has not been done yet. And you're saying we need to hold them accountable, right? But of course, again, the national coordinator of the National Mental Health Program at the Federal Ministry of Health and Social Welfare, Tunde Masi, he said something. He said, about 30% of Nigerians will suffer from one form of mental health condition during their lifetime. I also see that about the treatment gap is around 80%. This is worrisome. But what does this really mean for Nigerians right now?
Well, what it means is that on a daily basis, people will continue to go through one form of mental health condition or the other.
Okay.
And it's even on the rise because of the current economic situations. Talk about insecurity, talk about poverty, people trying to survive on a daily basis.
Yeah.
It's definitely on the rise. And sadly, that also means that many Nigerians do not have access to the help that they need. Because one, again, talk about the economy. The average Nigerian cannot afford therapy. They can't even afford to get psychotropic drugs that they may need to cater for their mental health.
Yeah.
So it's a lot.
It is a lot.
It's a lot.
All right, let's talk about the awareness, because this month we read out Breaking the Silence on Depression and Mental Health in Nigeria. I do understand that therapy is such an expensive commodity to be able to acquire right now for an average Nigerian. But from the last conversation we had, how far have people come about expressing how they feel, regarding their mental state here in Nigeria?
I think that it's improved greatly,
Okay.
to be honest. I think I mentioned to Nen the other day that, okay, since the last time we came here that we spoke about the Mental Health and Rehabilitation Centers Directory that we launched, within a period of about 5 months, we had over 10,000 people make use of that resource.
Wow.
In Nigeria.
10,000?
Yes. Over 10,000 people made use of that resource. So we can see clearly that, more people are starting to speak up about their mental health, about their struggles, also going ahead to find out where they can actually get help from. However, awareness is still not enough. I think at this point it's becoming a song that we sing all the time. Awareness here, awareness there. But awareness does not train the doctors. It doesn't create clinics. It does not even create the mental health department, which we definitely and urgently need to ensure that, there are more coordinated efforts when you talk about mental health in the country. And that's part of the reasons we went ahead to launch the tracker. Today, we have officially unveiled the Mental Health Policy Commitment Tracker in Nigeria. It's the first of its kind.
Okay.
Yes, the government said this. The other time, like you said, they said they would decriminalize attempted suicide by December. It's been 5 months. The government said that in emergency responses, they would go ahead and include mental health measures there, ensuring that data is being collected on that front. But things have still not happened on that front. So, I mean, so many things to say all at once when we want to talk about accountability, about how far Nigerians have come. But the major thing is awareness is no longer enough. Is it helping? Yes. Is it helpful? Yes. But can we continue to do that? No. It's already a beating drum that we need to move past.
You talked about the fact that awareness, of course, is not going to help in training doctors as it is. But we have doctors in Nigeria. Would you understand the concept of the brain drain as it is? Are we speaking on getting to retain the doctors in Nigeria or even get to train them as it is? Which of them is the major problem for us here now?
I think in relation to mental health, the major problem would be training them. Okay. Because as it stands, we have just about 300 psychiatrists attending to over 200 million people. And that is way shorter than, what is expected of us by international organizations like the World Health Organization. As it stands, that's calculates, or when you break it down, it means that we have one psychiatrist attending to over 800,000 people. And by the WHO standard, you should have one psychiatrist attending to about 10,000 people.
That's a lot. The disparity doesn't. So is there a specific training for mental health doctors? Because what he was asking was basically about the brain drain of Nigerian doctors. So do we have separate medical doctors that attend to just mental health issues, or any doctor at all is able to attend to that?
So we have doctors that specialize in the mental health field, and most of them are psychiatrists.
Yes, that's psychiatrists.
In terms of training, yes, specialized trainings. One of the major ones that we always push people to have is training on mental health first aid, which basically everyone should actually have such a training. There are also, specialized courses that people can take, even the doctors, to ensure that, they keep up with the rapid change in the system, in the space of mental health, even talking about the advocacy aspects beyond the clinical aspect of, treating people.
Okay. I think one of the things we talked about in the last conversation we had with you was basically social and behavioral change regarding mental health here in Nigeria. And the Lunacy Act of 1958 called mentally ill people lunatics, which that word shaped how society thought about mental health conditions, how people perceive. In fact, right up until today, when you tell a person they're mentally unstable, they automatically just say, I'm not mad, you know, thinking that that's almost exactly the same thing. So my question is, how has the new law changed how people perceived? And this is 2026. We've had the conversation in 2025. Do you think the perception has changed from then on till now?
Basically, yes, I would say it has changed, but it's still very much sitting along the lines of awareness, awareness, awareness. Now we know that you should not refer to someone as mad. You should not equate mental health to madness. And that is mostly in the urban environments. People in the rural settings are completely or almost completely left out of this conversation. So they still see it in that light of stigma and all of that.
Why are they left out?
They're left out because, you know, we are not at state level. Mental health implementation is not just at the federal government level, right? It's also at the state level. But sadly, even at the state level, most of the efforts concentrated on mental health are found in big urban environments. You don't find them going there. Normally, according to the new law we have in Nigeria, mental health should be integrated at the primary health care level. So basically in all the wards in Nigeria, they should have something around mental health. But that hasn't been done, so we've not been able to reach the people where they need it the most, in the rural environments.
And what is stopping that? Resources?
Resources, lack of training, most importantly, the lack of the creation of the mental health department within the Federal Ministry of Health, where all efforts concerning all things mental health should be concentrated and brought up from.
All right. However, there are certain misconceptions as well when we talk about mental health, depression and not being part of it. Some persons still think that when someone is depressed, it is a spiritual issue, and therefore what should be done is to pray away that particular illness as it is. But talk to us about this misconception, because we still see these things happening in 2026. Yeah.
Well, I would always say that the reason why we have such misconceptions is because we have not learnt enough what, you know, mental health is truly about. And again, you must not rule out the fact that we are a religious nation. Okay, so everything that happens to us, even if it's an accident, we attribute it to a spiritual force. Something is trying to fight us or trying to, you know, take our lives away. So I would say that is wrong, right? Truly, so many things come together to affect a person's mental well-being. It could be the environment. Even the environment that you grew up in can affect their mental health. It can spring up until the point of adulthood. It could be things such as, you know, going through a hard patch in life and not being able to, you know, come up from it. So mental health issues, or depression specifically, should not be attributed to religious or spiritual issues alone. Sometimes it's just life that is happening to such a person, and the right way to approach it, in as much as prayers are, you know, important to us as a people, you should seek help from the right professionals. I mean, wisdom is profitable to direct, right? So in as much as you face the spiritual aspects, you should also go ahead to face, okay, yes, there are professionals in this space, I should talk to them as I need to.
The last time you talked about early detention being key. Again, in this part of the world, people, we understand that some persons are beginning to pay attention gradually, but again, it is still difficult to detect the signs early enough. Now, what are some of the things that people need to look at again, you know, to see that this person might be a bit mentally unstable or going through a depression phase in their life?
So usually they are normal, or I would say common things that we would see in a person. For example, their normal behavior. Maybe if usually someone is outgoing and all of a sudden they're, you know, quiet, isolating themselves, just quiet to themselves, then you should know something is growing up. It may not necessarily be that at that point you diagnose and say, oh, because you're quiet, then
something is wrong.
Something is wrong. But when you've noticed it, you know, overwhelming sadness for at least a period of 2 weeks, you can say, something is happening. You cannot fully diagnose, but you can say, okay, maybe something is happening here, we need to check it. Also, things like change in eating habits actually means that somebody may be going through a mental challenge. If you notice that they're now eating too much or eating too little, or even starving themselves, it may be that. As well as, you know, other things such as sleep pattern. You're not sleeping enough, you're sleeping too much. Just being on two sides of the extreme sides of, you know, it all could show that a person is going through something mentally.
All right. And what then should be done? Seek help.
Seek help. So beyond seeking help, actually, there are day-to-day things you can do. For example, confiding in someone that would not ridicule you. That's very important. Someone that would actually not judge you. So it's been shown over and again that physical health has been linked to mental health, mental well-being. So doing things such as exercise, you know, eating healthy can actually help a person. And then when you see that, okay, it's prolonged, it's beyond what you can manage on a day-to-day basis, you can say, okay, at this point, I think I need to see a therapist. I need to seek professional help in relation to my mental health.
All right. With Boko Haram, banditry, farmer header clash, and kidnappings, we have a new generation of Nigerians going through a kind of trauma that is yet unnamed, because these are just emerging realities. I know they have happened, you know, in 2015 with the Chibok girls, but we have seen an intensified attack on communities here in Nigeria. How do we even begin to deal with that? Because if we haven't named it, then how can we even find solutions for it in the first place?
So, you know, over time, as a result of all of those things that have happened in the past, as a result of the history, the government has made promises again. One specifically, again, last year on World Mental Health Day, was the coordinating minister and, you know, other key stakeholders making promises about including mental health into emergency support. So this environment where, you know, Boko Haram is operating, or their insecurities, you know, that there's a high level of insecurity, right? It's a place where may be tagged as an emergency zone. So they have spoken about the need to include mental health support and also screenings in such settings. But sadly, it's been all talk, as always. Yes, we're going to do this. Okay, now we're excited. We're waiting to see when you'll make it happen. Nothing has happened. Truly, nothing has happened. And over time, you know, as also major stakeholders in the space, we try to approach them. Oh, you said we're going to do this thing by this date and that date. What's happening in relation to it? Now, this specifically in relation to insecurity has also been noted by the international organizations. World Health Organization was also present in that meeting last year on World Mental Health Day. That was the 10th of October. They also made emphasis on this. They need to do this because over and again, as history has told, we see it coming up. Sometimes out of nowhere, we just realize that in a specific state, something is happening and people are left to just care for themselves. Sometimes they never move out of their phase of their lives. For the rest of their lives, they're left to, you know, struggle through it. And some of them sadly end up deciding that, you know, life has no meaning, going ahead to take their own lives. That is why we keep preaching the point about accountability. We can no longer talk about awareness. We can no longer say that, okay, yes, you know, turn on the cameras, let's talk about the need to do this, and when it's time for you to act, you're not acting on it. It's time for us to truly move beyond that. I think talking about it alone, you can see how.
I mean, there's hardly a person who would have conversations like this without getting agitated. But yes, let me take you a bit back to the policy commitment tracker that you have set up. Now, can you give us like a picture of what this framework should work like? I know you've explained what it is, but what does this look like?
Okay, so basically it's a public-facing tool, right? Where anyone can use to track things, even at their local level, not just at the federal government level. And basically on that tracker, which you can find at www.nigeriamentalhealth.org under the page policies, you'll be able to find the policies, the dates where, you know, it was enacted, as it's been, if it's been enacted, or when it's been spoken about, as well as commitments. So basically you're able to search through all of it at the national and subnational level, because some states have gone ahead to make laws in relation to mental health for themselves. And some of them are, you know, coordinating bodies. That's through the national, I mean, the Federal Ministry of Health. So basically you're able to go there to search what you want to find, whether by, you know, the name, if you know what it's, the specific law is, or what area it caters to, as well as the year it was spoken about, or even the coverage, that's if it's a national or the subnational level. You can also search by the stakeholder, or you want to see what the federal government is doing in relation to mental health, or you want to see what a specific civil society organization is doing in relation to mental health, the commitments that they made. Most times these commitments are linked to the policy that has been created. For example, one major one, again, I would say, is the National Mental Health Act. It mandated that there be a mental health department, okay, that is a commitment that was made as well, because it's also been spoken about over and again. But nothing has been done. So basically that tool is to ensure that the track, I mean, is to ensure that, you know, we're able to keep track of these policies and also update them, because sadly sometimes some states may be doing some work, but you know, it's not publicized enough, so we don't even know. Sometimes some commitments have also been made at the local level, but we don't know about it because, you know, we are not exactly in those environments. So this tool is to ensure that we can track all of it all at the same time. Everybody, whether you're in the northern part of the country or you're in the southern part of the country, you have a major voice in relation to this, and ensuring that the government actually does what they say they would do in relation to our well-being.
Thank you so much, Deborah Omage, for joining us on this conversation, and thank you for your input on that. But before you go, we like to let you do that thing where you speak to people about, you know, mental health and how they can, before these policies are being implemented, what can people do, an ordinary Nigerian do, to ensure that they preserve a healthy mental state?
So I would say, for one, you know, always remember that the sun doesn't always shine on every day, but it doesn't mean that days won't come where to shine again, right? So you need to take care of yourself, because you cannot pour from an empty cup. Sometimes if what is triggering you and how you feel mentally is on the internet, then you take some time away from the internet. Find your support system. That is very important, okay? Find someone you can confide in, someone you can talk to. Take up daily practices as well that, you know, can help your mental health, whether it's journaling or whether it's taking part in one form of exercise or the other. Your mental health counts and you matter as a person. So we want to see you alive and well.
Thank you so much, Deborah Omage. She's the Program Associate, Nigerian Mental Health. Thank you again.
Thank you.
Thank you.
All right. Now, the conversation of mental health cannot be overemphasized, because with recent happenings in Nigeria, it is almost difficult for a person to be mentally stable. Because you get online, especially for us, you know, we say that all the time, you have to be in the know of whatever happens within the country. So sometimes it can be overwhelming for you as an individual, and the nation, I'd say at this point, is quite overwhelmed. If you follow the trail of messages and uploads on social media, I think we all are in the same mental space right now.
Very true, and I think that's the reason this conversation is very important as we speak now, and the solutions that our guest has given is, as much as possible, if the social media is crowding your head and affecting your mental health, step aside from it as long as you can do that. I mean, we all need to just pay attention to our mental health, and if you begin to see some of these symptoms, again, seek professional help as soon as you can.
All right. Thank you so much for joining us on the conversation this morning. Remember, we are active across social media platforms. On Facebook, on Instagram, on X, and on TikTok, it is at Rapid TV. On our YouTube page, it is at Official Rapid TV. And www.rbnradiotv.com allows you to connect with us anywhere in the world. Once again, my name is Martha Alo.
And I am Victor. Okay, we'll see you tomorrow.